Hi, my name is Dr. Chris Gubbels here from Square One, and today what I'm going to go over is the 5 biggest things that we see, like the 5 most common causes of neck pain. And as we go through this, we're going to do a series where we're going to go over, we're going to actually show you the individual conditions, each one of those, and we're actually going to show you some different treatments and then how we actually go about correcting those. So the first things we're going to go over are related to overall alignment in the spine. And one that a lot of people don't think about is alignment of your body from the front to left and right. So one of the common things that we see is when someone has a lateral shift of their neck to the left or a shift to the right. And meaning the spine where it's supposed to be straight up and down, where someone actually has a lateral shift. So that's one of the common things that we see, and one thing that we'll always evaluate for right away. One of the other ones that we see, and that's real common, is when someone has what's called anterior head carriage. And this is when the head is actually protruding forward like this, where someone comes in, they walk like that. Normally the ear and shoulders should be lined up, but when someone sticks their head forward, and instead of having a nice normal curve like this, it actually sticks forward. So that's another thing that we see a lot, especially now people that sit at computers every day, bending over, texting, those kind of things. Another alignment problem that we see is when someone has a loss of the cervical curve or the normal curve in your neck. Normally there should be a nice curve in your neck, your mid-back, and your low back. And these curves, they form arcs, and when you have these normal arcs and they move properly, this is very strong and it's very stable. One thing that we see due to a lot of times injuries, due to a whiplash, a trauma when someone's younger, that's not corrected is when someone can have a complete loss or a reversal of the curve. This is called a snap-through buckling injury. So those are overall alignment things. That's probably the 3 most common things we see in the neck or the cervical spine that we know lead to neck pain, advanced degeneration. Another thing that I'm going to show you on some x-rays and some later films is when someone has instability. And what instability is when a joint moves more than it's supposed to. It's real similar to when someone hurts their knee, ACL tears, something like that. The ligaments become stretched and the knee moves more than it's supposed to normally. That same thing can happen in the spine, and a lot of times that's related to an injury where the ligaments and tissues are just stretched or under forces more than they can tolerate. So that's a real common thing that we see. And then the last one, something that people don't think about, is inflammation. Now, we have inflammation when in a joint when something's injured, like an acute inflammation. And then we also have systemic inflammation, which is overall inflammation in the body, which has a lot to do with nutrition, diet, those kind of things. But it can lead to increased pain, it can lead to muscle spasming, it can get the tissues, can lead to what's called fibrosis, where they start to, harden up, those kind of things. So those are the 5 most common kinds of things that we see. Someone has a shift in the neck to the side, a lateral translation, their head is forward head posture when they have a loss or of the normal cervical curve, when they have instability from an injury or trauma, or when they have just chronic inflammation. And in the next videos, we're going to go over exactly how we treat each of those individual things, and we're going to show you some pre and post treatments and some actual case studies with those. So stay tuned for our future videos on the 5 biggest common causes of neck pain.